Absolutely. The past few days have been filled with trauma for most families across KwaZulu-Natal. From losing their homes to losing their loved ones, the recent floods have left them in a devastating state. How exactly are people expected to deal with this level of tragedy? Clinical psychologist Mzamo Mbuli joins us to unpack this story. Mzamo, thanks very much indeed for coming on. And that's the issue with what's unfolding in KZN, because it's not just about the loss of a loved one, but in many cases, it's also about the loss of breadwinners in a family.
Maybe also, Michelle, a sense of survivor's guilt as well. Why did my family member die and I didn't die? So a lot of shock, a lot of grief, a lot of bereavement, like you said, and possibly thinking also survivor's guilt for those people who did survive.
And then there's the issue, Mzamo, of multiple deaths. I mean, it's the unthinkable, isn't it? Multiple deaths in one family.
Sure. It's distressing, Michelle, to say the very least. And we also need to take cognizance of the first respondents who will also be exposed to the distress and this bereavement of people, because they will also be affected as much as maybe they weren't affected in a present capacity, but being exposed to this disaster will also affect them as well, emotionally and psychologically.
Yeah, in fact, one of the front pages in the newspapers this morning shows a responder on a beach covering the body of a baby who had washed up on the shore of a beach in Durban. And this is in the wake of the trauma of the past couple of years as a result of COVID-19 as well.
So we had COVID. We had the July unrest last year, and some of the people that are experiencing the floods would have experienced the past 2 years of trauma, so re-experiencing trauma. And if we look at the 6 phases of the disaster, some of those people would be going through the same phases 10 months later from the riots. That is, the second phase would be the impact, where the emotional response mirrors the disaster itself. It's a lot of shock, grief, a lot of sense of self-preservation, family protection, protecting the people that I do have with me.
Mzamo, you and I have been outlining, just in the first few questions of our discussion, just the level and the extent of the trauma for communities in KwaZulu-Natal. I mean, it's difficult for me to ask the next question of how do people begin to pick up the pieces? It's surely too soon to have that kind of conversation when we're still coming to terms with the extent of the loss.
Yeah, I think possibly what could be happening now, or what should be happening, is the third phase of disaster, which is when people respond according to their physiological responses, which is adrenaline, trying to help other people, trying to salvage what they have, but at a later stage, possibly 2-3 months from now, even a year from now, people will be going through feelings of abandonment, where they feel like the relief wasn't enough. What they've lost only is coming to terms maybe 2-3 months from now. But right now, a lot of sense, maybe behavior is being driven by adrenaline, a sense of community. We're all going through the same thing, a sense of togetherness. But 2-3 months down the line, it might be a different story.
Yeah. So as government now tries to respond to the various issues that have resulted from the flooding, from electricity to infrastructure damage, people who have now been left homeless, trying to get them shelter for the coming days, for the coming weeks. This is the leg of the response by government that surely must not be ignored, the trauma response from people, and how we should be providing assistance to help them come to terms with what's unfolded.
Absolutely. I would imagine that government would have organized counseling, especially for the people who are at risk. This is people who are obviously exposed to the disaster, people with pre-existing mental health conditions, and especially children who are going through this disaster, might have lost parents and loved ones. Those people, for me, are of critical importance at this time.
Yeah. Mzamo, we are an incredibly traumatized society, aren't we? just given our own history as South Africa, given the COVID-19 pandemic, you've talked about the July unrest as well. You know, the long-term impact, we're still to understand insofar as COVID-19 is concerned. And there are many other instances like this one, where it's only in the years to come that we will fully understand the extent of the trauma that we're all going through.
Sure. I think we're seeing it right now, Michelle. So obviously your usual suspects, your PTSD, depression, but I think in the communities that we are living in, even more so possibly substance use because of the prolonged trauma that people are going through in the communities, including the ones that we're seeing now in the floods in KZN.
Certainly. Mzamo Mbuli, let me thank you for your time this morning.